Hi, everyone. My name is Ashwin. I'm here to answer your questions on pharmacogenetics. So really, I just love to hear from you. There's no question that won't be looked at and tried to answer by myself. So just would love to hear from you and what you have to say about pharmacogenetics. So one question that's actually come in right off the bat, how do I actually use my antigen test results? So there are a number of ways which you can do it. Probably the easiest way is to get your healthcare provider's email address. So that could be your pharmacist, physician, nurse practitioner, et cetera. And then you can actually go log into our portal and use the share function to send report permissions to them so that they can review it. And then at that point, you could set up an appointment with them to review the results and to figure out how it fits into what medications you've tried in the past and or what medications you might be considering in the future. So looking at the genetic aspects, and then we sort of couple that with guidelines on treatment of different medical conditions. We look at factors that are unique to you, for example, your age, the functioning of your kidneys or liver, or even whether or not taking a medication twice a day just doesn't work for you, it doesn't work with your schedule. So really it involves sharing your report with your healthcare provider team, but it's a known fact that many healthcare providers don't have a shareable email address. In those cases, you can actually simply just print it off and make an appointment to discuss the results with them. So that would be a little bit more, that might be the case where you actually bring it, you book an appointment, you bring the reports there, and you discuss in that manner. So it might not necessarily give them as much time to prepare if they do want to do so, but the report is designed to be really easy to use and really straightforward. Even if, say, your healthcare provider isn't used to seeing pharmacogenetic test results, it's set up in a way that it's really just like, okay, got it, and they can take those results and help tailor your therapy. So got another one here. What medications do you test for? Are new ones added regularly? So actually I'm going to answer the second part first, and then I'll come back to the first part. So we actually add medications every 6 to 8 months based on new scientific data. And that basically passes through certain authoritative bodies in pharmacogenetics. So these are basically the source of validated data, and they rank medications based on the quality of study available. And so based on that, we sometimes do, actually we do usually add at least a handful of medications every 6 months. In some maybe less common circumstances, medications, the data actually may be downgraded based on new negative findings, in which case drugs may come off of our test. So that's something to note as well. And that's simply put because the medication guidance out there in terms of genetics is too weak to provide results that can be used for guidance. The medications that we test for, we test for, I believe, over 210 medications. So it's not something I can say where we test for all medications for heart disease, all medications for blood pressure. It is very much based on the drug itself, but I can say that we do have the vast majority of medications used for mental health. So these are typically, as you may or may not be aware, antidepressants. We often use anti-seizure medications for mood, particularly in bipolar disorder. We sometimes use antipsychotics. And we also use benzodiazepines, which are sort of commonly known as sedative tranquilizers. So we do have the vast majority of those on our panels. In addition to that, we have most of the opioid medications. And because in chronic pain, actually, we use many of the same drugs that we use in mental health, we do have a fairly complete complement of drugs within pain management. And then we kind of have a smattering of other drugs, and this is simply based on what has data. And so this includes a number of oncology drugs, many different neurology drugs, which, as I mentioned, are anti-seizure medications. We have some medications used in cardiology, so some of the statin cholesterol medications. We don't have too much in terms of blood pressure. There's not really much in terms of diabetes at this time, but these things are changing pretty regularly because the data is accumulating regularly. And actually, we do have, just in reviewing our list recently, we do have a number of medications used in various conditions that are specific to women, so things like menopause. And we do have many medications actually that are relevant for procedures and operations in hospital. So things like anesthetics. So these are actually very useful if you're having an elective surgery that can be sort of planned for ahead of time. You can look at what the protocol is at the hospital and compare it to the results. As long as you do have access to the surgeon or the care team that will be providing the service to you ahead of time to say, hey, can we have a conversation about this? So there are a number of different areas and a number of specific drugs. In some cases, there may only be one drug in a family that is covered under our test. So it is a bit of a mixed bag, but I guess the areas that I've just mentioned are really probably some of the strongest. So mental health, pain, neurology, women's health, oncology, perioperative, so around surgeries. So those are probably some of the biggest ones. So just a reminder that you can add your questions into the using the Q&A button, or you can use the chat function. So whichever you prefer. And again, really love to hear from you to see what questions you have, some of the challenges that you're experiencing, or just things that you're wondering about before you commit, or maybe you have taken the test and you still need some clarification. Anything goes really. So one question that's actually come in is, do I need a prescription? The answer is no, but with an asterisk next to it. So you do not need a prescription to purchase the test. However, some insurance providers will only reimburse it if you do have a prescription from your physician. So, that could simply be, in some cases, the insurer would be fine with your physician just taking a prescription pad and writing pharmacogenomic test or in a gene test and then signing their name and dating it and putting your name at the top. And some insurers may want more information, and we actually have a template that can be provided, that we can provide to you, that you can then print off and bring to your physician, in which case they can review, indicate your name and sign on it, so that it has additional information on our test that may be required by your insurer for reimbursement. So that kind of things that might be included are what genes we cover for, what conditions that test is being used for. So specifically pain or mental health. And even things like accreditation numbers of our lab, the physician that's associated with our company and her license number, et cetera. So there's multiple ways to go about it. But if you are submitting it to insurance, it is a good thing to kind of be armed with ahead of time, so that there's less hiccups in terms of getting reimbursed. So I guess another question actually that's coming through that I've seen a few times: why don't you test blood? How do you get these insights from the cheek swab, and what are you testing for? So they're really good overview questions, in my opinion. So we don't test blood because, simply put, we don't need to. Certainly we could get genetic data from blood, but that same genetic data is in your cheeks and essentially every other cell of your body, save for some cells in your bones. So really, you just basically put a Q-tip in the side of your cheek and rub it, and then put it in a test tube in a container, and messed it up and send it off to us. I'm sorry. So really, it's less invasive, it's easier. There's less precautions. so really, if we just need a cheek swab, if that's the simplest thing, then we're going to do it. There's no difference in terms of the quality of the data we get from a cheek swab versus a blood test. And what are we testing for? So we're testing for the genes that are involved in coding for proteins, which are essentially the machinery of the body that are involved in processing medications. So the vast majority of these proteins, the genes that we test for that code for these proteins, are involved within a system in the liver. We call these the cytochrome P450 enzymes. And these are typically involved in breaking down medications into inactive forms prior to excretion. Sometimes they're involved in making active forms. They may actually take the active drug and make other active forms. They may be more potent or less potent. And in some cases, some medications are actually in an inactive form when you take it, and they actually activate them in the liver. So we test for those. There are a number of other proteins, say at the site of action, say, on the cell where there may be a receptor on a cell. For example, there are opioid receptors on many cells in your body, and opioids bind to these to tell your body to, well, not essentially, it creates a physiological chain reaction to reduce pain. And some of those receptors do exhibit variances across individuals. So the tests do test for those things, but those are less so. And then there are other types of proteins as well that are involved in even just shuttling the medication into a cell to have its physiologic effect. So there are a number of other processes that these genes code the proteins for, but primarily we see them through the cytochrome P450 system, and we are testing for the genetics that are essentially the blueprint for the proteins. Another question here is, how are you different from 23andMe? 23andMe is actually, at least in Canada, is focused on genetics in general. So they will look at things like disease variants that are determined in large part by genetics. They'll look at those disease variants and be able to say, you may have increased risk for, say, colon cancer because one of your parents had colon cancer, which was genetically determined. So those, reading those genes can help with that. It also may be helpful for things like heredity, for your ethnic background, for example. Maybe you're 12% Irish and 11% Scottish, another percentage First Nations, et cetera, et cetera. So they really just focus on your genes in general, but they don't actually look, at least in Canada, they don't look at genes involved in processing drugs. And so we don't touch with that aspect. We stay in our lane in a sense where we focus on drugs because we want to be the best we can at that by just focusing on that. So I know sometimes individuals are curious about having more of a generalist genetic panel done, but we really just focus on drugs. So we are different. We are quite different between 23andMe. The next question coming in is, will the results of this test affect my insurance policy? No, because simply put, in Canada, as of, I believe, 2017, there is actually a specific act signed into law called the Genetic Non-Discrimination Act. So insurers do not actually have the right to your genetic tests. So even if you are paying and submitting to an insurance plan, all you're saying is, I used a genetic test. They don't get access to the results. The results are strictly between you and your healthcare providers. And even if for some reason they did come across you sent your test results accidentally to them with your receipt, they have no basis upon which they are allowed to make decisions on your insurance policy. Otherwise, they are liable. Another great question that's come in that I've seen a few times as well. Is there an age limit to this testing? Can my 2-year-old get tested? So there's no age limit. Your genes are determined at the time of birth. Where things get a little bit tricky is in very young children, so 0 to 2 years old. What happens is many of these genes have not been fully translated into the proteins I mentioned earlier that are responsible for processing these drugs. So essentially, we could do the test and create a report based on the genetics, but that would tell us how that child might respond when they're older, say after 2 years old, into adolescence and into adulthood. But the testing results would not be reliable and are not advisable to be used for treatment decisions before the age of 2. So again, the genetics are accurate; they just have not translated into something meaningful to be used in a clinical setting in those cases. Does the test look at alternative medicines or cannabis strains? So we really do rely on what scientific data has been made available. So in terms of alternative medicines, there's really a paucity. There's a lack of those that have been studied in terms of genetics that can be actionable at a clinical level. Though cannabis does have preliminary data, and as such, we have included it on our panel to be something that can be looked at and considered as part of the entire picture of your health and your unique circumstances. So these are preliminary, which means that tests and studies need to be repeated to create more definitive advice, but they can give us some clues as to whether or not, for example, you may require a ratio of THC to CBD, so that the two quote unquote active components, although that's debatable, of cannabis. So you may, for example, process CBD much more slowly than we would hope. And because CBD offsets the effect of THC, and for example, say you're looking for something with higher THC for therapeutic effects, that may suggest that you need something with that ratio of higher THC to lower CBD. So that may give us a clue as to how you may have responded in the past, or you may respond in the future if you are naive to cannabis. But again, it kind of has to be taken, it has to be approached with caution because it is still preliminary. Let's see here, getting a few questions here. What about privacy? Is my genetic data protected? This is a great question. Should be top of mind, quite frankly, with a lot of the privacy breaches and the ongoing saga with big technology companies and privacy of data. So your data is absolutely protected. In fact, after we run your tests, we ask you if you'd like us to save the data in an ultra secure manner, or if you'd like us to destroy it for you. So it's really in your hands, but either option will protect your data. So there's really nothing to be worried about. We do not sell your data. And in fact, if you had your test done and you wanted me to look it over, even though I work for Inagene, I couldn't just go in and look at it. You'd have to give me permission through your portal, as I mentioned before, just as you would any other healthcare provider, for me to look at it. And in fact, you could actually revoke that access in the future should you wish as well. So absolutely protected. There's no funny business going on with your data. There's no sales of your data, and it's protected. We are we take every possible measure to make sure that it is protected. There's nothing to be concerned about at all. So I'll just give you guys another minute or two to see if, got a new question here. 2 questions. Are the results of testing impacted by the medications we currently are on? And how often should testing be done? Will it change over a lifetime? These are fantastic questions, and I do appreciate that. So the results of testing are not impacted by the medications you are on because your genetics are predetermined at birth. So one thing to note is that drug interactions are often are the mechanisms of drug interactions are often through the same enzymes that I've mentioned that are are determined by your genetics and are very, very relevant to pharmacogenetics and may actually impact your response. But your genetics at the baseline are the same. So for example, if you were getting the test done and you had your results on a certain on medications you've been on, we would take that, you would take that data and then you would actually look at the other medications you're on and the drug interactions. And then we'd look at other factors, of course, like your organ function and your age, and then create a full picture of what you've experienced or what we may expect you to experience. So we really have to layer these things on top of another. In the purest form, the test, if you weren't on that medication that was, say, triggering a drug interaction, the test would require less layering of data and considerations, but the baseline is exactly the same. It just relies on, you know, usually a pharmacist to be able to say, you know, you're likely to respond normally to this medication under normal circumstances, but aha, I looked at your medication list and you're on this medication that actually slows down breakdown of this medication. So in fact, the medication is accumulating and that's why you're having side effects. So it may actually, though on paper it is a green drug, you may not be experiencing the tolerance that one would expect by simply looking at your pharmacogenetic report. And then the other question is, how often should testing be done and will it change over lifetime? Actually, you just have to do it once, which is the beauty of it. And I think, I mean, not to toot our own horn too much, but part of what we do at Inagene specifically is built into the test is the fact that you have lifetime updates. As I mentioned, we do 6 to 8 month updates. And all you have to do to access them without any additional charge is go back to your website and rerun the report, and you'll have the most up-to-date data based on the newest findings. But your genes don't change over your lifetime, so you never really have to do it ever again. So yeah, so that's the great thing I would say about it. I hope that's answered your question. If you do have a follow-up, please feel free to send it my way. It looks like we're oh, okay, great. I see that here. Thank you. I appreciate that. And I can invite also everyone before we wrap up that you can also message me if you have other questions that come to mind or comments. I'm just throwing my email address into the chat box, so I'd welcome you to get in touch with me because I really do enjoy educating and interacting with you. But it looks like we're drying up in terms of questions. There's not much else coming through. I will give you another moment or so to see if there's anything else that's coming through. So yeah, so if you have anything written down or just sort of kind of racking your brain about that question you thought of and maybe aren't recalling the moment, take a moment right now to think about that. Okay, so it looks like we're good to wrap up. I guess we finished with a couple of minutes to spare. I hope I have been able to educate you and inform you on pharmacogenetics and to able to make you to let you enable you to make an informed decision about your health in the future. And again, I welcome any questions sent directly to me in the future. And we are hosting these every 2 weeks. So if you do have, say, family or friends that are curious, please pass on the news that we do plan on doing more of these in the future. With that, I wish you a wonderful evening, and I do thank you for taking a bit of time out of your schedule to join me this evening. Have a great night, everyone.